Malaria was an endemic disease in the American South in the early 20th century. Malaria is transmitted to humans through mosquito bites. Public health nurses and doctors were important rural healthcare providers who tracked and treated malaria cases during this time. They would administer malaria tests during house calls by collecting drops of blood on a slide that would be examined under a microscope. Doctors would administer anti-malarial drugs to their sick patients. The drug quinine was typically made by mixing crushed tree bark into a tonic. Quinidine was another anti-malarial drug shown in this exhibit in pill form. The Tennessee Valley Authority is most well known for constructing dams along the Tennessee River during the Great Depression, in turn creating thousands of jobs. What isn't as often discussed are the public health implications of the constructions of these dams. The mosquitoes that carry malaria thrive around large bodies of standing water. Dam reservoirs were potential breeding grounds for mosquitoes. The TVA could exacerbate the malaria issue in the South, but there were innovative, proactive control measures developed to prevent that from happening. Dr. Eugene Lindsay Bishop, the leading figure of the Tennessee Valley Authority's Health and Safety Department, established the Malaria Control Division to confront this issue head-on. This division included scientists and public health professionals who made significant strides in the fields of epidemiology and vector control in a time where federal funding for those fields was limited. The projects that Dr. Bishop led demonstrated how modernizing a region goes hand in hand with improving public health. Dr. Bishop was a widely respected public health professional before he joined the TVA and remained so well after his time with the TVA came to an end. He won the Lasker Award in 1950 for his leadership during the Great Depression and lifelong commitment to the field of public health. Included in this exhibit is a photo album gifted to Dr. Bishop by his friends at the TVA after he received the Lasker Award as well. This exhibit features 2 published records of malaria control activities in Tennessee. The Green Book, Malaria and Its Control in the Tennessee Valley, details the activities of the TVA's Malaria Control Division. It discusses the following strategies: the treatment of land with larvicides like Paris green to kill mosquitoes, the use of netting to create a barrier between man and mosquito, the improvement of drainage systems, and the cleaning of shorelines. Improving sanitation was a key goal. The Tennessee Department of Public Health Bulletin featured here was published in April 1954. This article on the history of vector control in Tennessee credits the TVA's malaria control activities as really kicking the movement into gear. When DDT was developed in 1945, it was sprayed in Tennessee to continue malaria control activities and kill mosquitoes. However, DDT killed more insects than just mosquitoes. Ticks, spiders, and fleas carried diseases too. So the field of malaria control shifted to become the more general field of vector control as this new insecticide was implemented.